For over a decade as a doctor, I've cared for homeless veterans, for working class families. I've cared for people who live and work in conditions that can be hard, if not harsh. And that work has led me to believe that we need a fundamentally different way of looking at healthcare. We simply need a healthcare system that moves beyond just looking at the symptoms that bring people into clinics, but instead actually is able to look and improve health where it begins. And where health begins is not in the four walls of a doctor's office, but where we live and where we work, where we eat, sleep, learn, and play, where we spend the majority of our lives. So what does this different approach to healthcare look like? An approach that can improve health where it begins. To illustrate this, I'll tell you about Veronica. Veronica was the 17th patient out of my 26-patient day at that clinic in South Central Los Angeles. As someone who's spent years working to integrate healthcare and social services and advance health equity, I've seen incredible programs struggle to secure sustainable funding. I know firsthand how frustrating it can be when you're asked to prove value using traditional ROI methods. Too often, traditional ROI leaves out the outcomes that matter most, like improved health, patient satisfaction, and stability for families. That's exactly why we created the blended value for health equity method. With this approach, you can tell the full story of your program's value, especially for communities that have been historically under-resourced.
The blended value approach isn't just about better analysis. It's about more resources, more rigor, and more support for the work that creates healthier and more equitable communities. Each module will include video instruction, interactive knowledge checks, and real-world examples. We'll share helpful resources and prompt you to apply your learning through worksheets in the blended value workbook.